And still on the Health Watch, we want to turn now to something you've been hearing a lot about lately, a fungus known as Candida auris. The CDC is on alert, citing a rapid spread, particularly in healthcare facilities. Now, there's a lot of unknowns here, so we decided just to bring in an expert. Let's break it down. Let's understand it better. Joining me now is Massimo Pacilli, Deputy Commissioner for the Disease Control Bureau of the Chicago Department of Public Health. Good morning.
Good morning.
Thank you for being with us to help us understand this. What exactly is Candida auris? What are the symptoms? And also, who's most susceptible to this?
Yeah, thank you for the opportunity. So Candida auris is a fungus, sometimes called C. auris. And so it's different from bacteria and viruses, right? It's considered an antibiotic-resistant threat that can spread in healthcare settings. And it can spread via person-to-person contact or contact with contaminated surfaces. C. auris has been known to us for some time. It was initially identified from the ear of a Japanese patient, hence the name auris for Latin for ear. But since then has really been observed throughout the country, resulting in some healthcare clusters in multiple countries. It's been known to us here locally, identified since 2016, so we have some experience here and lots of work from both the health department and our experts in clinical settings. Candida auris is really concerning for three main reasons. It is often multi-drug resistance, meaning that it is resistant to multiple antifungal drugs commonly used to treat Candida infections. And some strains, in fact, have been found to be resistant to all three classes available to treat this type of infection.
And you mentioned that we've seen this before. It isn't new,
right,
but we've seen a re-emergence of this fungus. So let's talk about your studies on Candida auris here in Chicago. I know you looked at response in a long-term care facility in particular. What did it reveal? What did you guys find out?
That's right. So Candida auris isn't really a threat for general public. We find it primarily in care settings, and really among patients who have a lot of experience in the settings. They're residing there for very long periods of times. They rely on lots of hands-on care, on multiple medical devices. And so in these settings, we've done a lot of work to enhance the detection that leads to the implementation of infection control, prevention, and containment strategies. In these settings, particularly in long-term care settings that house medically complex patients, like ventilator-dependent individuals who have multiple comorbidities, and they're in these settings for very long periods of time. We've seen sort of a really focus following in this type of facilities. Candida auris is primarily a threat in long-term care facilities that house medically complex patients. Here's where we have done work to assist the facilities to identify how many individuals may be really colonized, so without causing infection, having Candida auris on them, and also identify where in the environment it may be found. And we really found that individuals in these settings are colonized for long periods of times. We can find Candida auris throughout the environment. And so it's really important to have perfect adherence to infection control precautions. So hand washing, using personal protective equipment one time only, then as moving from patient to patient, and then really cleaning the environments with agents that are effective against Candida auris, and doing so consistently on a daily basis with these agents that can really sort of diminish the burden of Candida auris in the environment.
That helps me understand it definitely better. So what are some health officials doing right now to make sure this doesn't turn into another March 2020? I mean, obviously, health is so much more a concern for us than I think it's ever been. Is a vaccine being created? What's happening now?
That's right. There isn't quite a vaccine here. But what we're really doing, the intervention, it really is in the clinical settings, right? This is affecting primarily those in these care settings. So here, the really best prevention strategies are identification, so doing a lot with the laboratories that identify appropriately this type of fungus, to the infection control practices. So we train a lot of healthcare practitioners, and then the environmental cleaning. These are really the core components. There is then continued importance, particularly when individuals are then infected and may result in kind of severe infections from these pathogens. There is testing for the susceptibility to those antifungal medications that are used to treat these infections, so that the right medication is used to treat the patients that can then clear the infection. But again, it can result in these settings in a long-term colonization, so it really relies on consistent and a really strict adherence to these practices.
Massimo Pacilli, Deputy Commissioner for the Disease Control Bureau of the Chicago Department of Public Health. We appreciate you being with us, and I know people can go to your website to find a lot more information and resources. Thank you.
That's right. Thank you so much.